pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I would consider a motion for the approval of the agenda.
So moved.
Second. All those in favor say aye.
Aye.
Motion carries. I would consider a motion for the minutes of the October 14th, 2024 regular meeting.
So moved. Second.
Okay, all those in favor say aye.
Aye.
Okay, motion carries. Any citizen wishing to make statements during the discussion of any item must first be recognized by the commission chair. After being recognized, that person should state their name and any organization represented. Statement should be limited to 5 minutes. Please silence all phones and electronic devices. Recording the meeting is allowed, and the commission requests that anyone using special recording equipment be seated in the back row to avoid creating a distraction during the meeting. So we have no old business, so we move right to approval of appropriations, and we have Schuyler County Clerk 2%.
Good morning, Commissioners.
Morning.
This morning, we have the regular accounts payable register for October 7th of 2025 to October 21st, 2025. Just ask for approval.
All right, do anyone have any questions for Bev? Or would like to make a motion?
Madam Chair,
Yes.
I'd move to approve appropriations for the period of October 7th, 2025 to October 21st, 2025, and authorize the commission chairman to sign on behalf of the commission.
Okay, we have a second.
I'll second it. Go ahead. Go ahead.
Go ahead.
I'll second it.
Hey, Dwayne seconds that. So all those in favor say aye.
Aye.
Okay, motion carries. Okay, under new business, we have a public health update with Karen Winkleman, Public Health Director. Morning, Karen. Morning.
I appreciate the opportunity to come before you this morning to talk about public health. We tend to prefer to be in the background, but so much of the work that we do involves the entire community, and occasionally it requires that we come out in public and talk about our programs and our activities. As you know, I like history, so I'm going to start with one statement by Winston Churchill, and he says that healthy citizens are the greatest asset that any country can have. So with that in mind, that is our why. That is our why with public health. 2025, the Kansas Health Foundation, the CEO reminds us, and his statement is, "I fear that our enthusiasm for what we can heal is blinding us to what we can prevent. Health is a leadership challenge. Leadership is an activity, not a position. Leadership is mobilizing others to make progress on daunting challenges." And I think that is a huge statement saying how we have to have our partners, we have to have those networks, and we have to have collaboration and work towards common goals and not be afraid to fail sometimes when we initiate something. So with that, I'm just going to go over a few things that we have been doing in the last few months. And by all means, this does not capture everything, but I tried to pull out some highlights of things. We expanded our operational hours and we increased that accessibility to meet the community needs with support of you as the Board of Health and as the commissioners. We have staff meeting every Monday morning from 8 to 9, and that truly is about the only time that our staff is all together in one space, because after that hour, we disseminate and do our programs, do our activities, do our visits, whatever is required. And then we open to the public at 9. We're open till 6. Tuesday, Wednesday, Thursday, we're open from 8 in the morning till 6 in the evening. Fridays, we're open from 8 to noon. Originally, we had tried some hours and we closed through the lunch hour. And surprisingly, my staff said, no, we need to be open because it's too hard to turn people away that come in from 12 to 1, and we don't have nurses available to provide those services. So we pivoted a little bit and started staggering, and it's been a win-win, well accepted by staff. Technology, obviously technology has evolved greatly over the years, and digital outreach. Again, we can't do it alone. Our IT department has been phenomenal in helping us get some of our things installed that we requested, or just kind of brainstorm with us. In light of that, we have several digital platforms that we can share educational material, and we can keep those current. In the past, we would have to have posters pasted to the walls, and sometimes it was hard to keep those updated and to make it look nice. We now have TVs in the exam rooms, and we can put pertinent information up and quickly. That was great help from our IT department. And we also know that our building, just the mere structure of it, sound travels. So we explored the idea of having some white noise. And again, that was successful in getting that installed. So obviously we need other partners to call on for those kind of things. Mobile outreach services, we had a mobile unit years ago, and it kind of fell apart literally while we were out on outreaches, and that was years ago. And in 2021, maybe 2022, we did get a mobile pull-behind camper. And so it has been very helpful. We take it out to different communities. Sometimes in town, we will take it to events just for the visualization as to where we're located. But through the flu outreaches, I've talked to you before about going out into the small communities, and we did that again this year, and we've done that for several years. And this year we had a great response, had over 62 flu vaccines given to people that maybe struggled getting in, and to let them know that public health still sees them. They're not just hidden away in those small towns, small communities. So the mobile unit has been great. We also go to businesses. Some businesses like to do health fairs for their employees, and we will go on site, take all of our supplies, go to a room they assign to us, we draw labs, and then get the results back to the employees. So we're open to doing whatever kind of programs we can provide with that mobile unit. We also do mobile services out at the college. It was a new initiative that we started kind of at the end of last school year, where we go out once a month, and we have a designated day and 2 hours. We are on campus. We coordinate with the school nurse out there, and we bring out vaccines, we bring out testing supplies, and consult, just on any health related thing they might have a question on. So that has been very useful. We've even had faculty come and take advantage of those services. So again, we are going to them and meeting their needs where they're at. Environmental health, and this is a really new initiative, and so I don't have a lot of information on it. I think I shared it with you a little bit last week, but we have this new sensing device on air quality for environmental health. We're not sure yet how we want to use the data, and we just have a lot more to learn about it. Emergency preparedness, we have a regional emergency preparedness, and we have funding for that with 6 counties involved of our surrounding counties. And typically when there's funding left at the end of the grant year, we all brainstorm on what we could use for our own county. And this was a common request, and it was to check air quality, because that affects our public health, that affects our health in so many ways. So it's called Purple Air. And what you will see is, again, with IT's help, on our webpage, on the Barton County website under Health Department, you will see this little box here, and it gives real-time air quality. And it kind of, you can look at the range, you can look at it compared to other communities. And I looked last night, and I believe it was us and Ellis County might be the furthest west at this time. There are a few scattered towards the east, but our region is Pawnee, Stafford, Rice, missing some in there, McPherson and Celine, and we all have the monitors now. So it'll be interesting to see. Emergency preparedness. You never know what the emergency could be, whether it would be a pandemic or whether it would be a natural disaster. But we go through a lot of trainings and we also go through a lot of exercises just so we know where things are at. And that usually involves bringing people together that know who has what resources so we can share. And knowing your partners helps so much during those exercises. Recently, we cleaned out one of our sheds from 2001 funding that supported emergency preparedness after 9/11. And it was amazing the things we had that we didn't even know we really had. Fortunately, we haven't had to use a lot of it, but there were times we probably could have. So Sean Kelly and I and Lindsay have really been having conversations of let's get things organized and know where things are at in a hurry, whether it be for us or whether it be for resources for someone else. National Drug Take Back event. I bring that up because the event is this Saturday from 10 to 2, and this is the event that we've been participating in since 2016. It's in collaboration with the Barton County Sheriff's Office. They are the lead in it, with it being from the DEA. To date, we have collected real close to 4,000 pounds of unwanted, unused, expired medications. And when we think about the 4,000 pounds, that sometimes it's literally a baggie, a Ziploc bag full of just pills. That's no containers, nothing. And it's just amazing what's taken in that's out of circulation for the wrong hands to get on those. So we are getting ready, like I said, this Saturday from 10 to 2. We also have I believe there's a Halloween parade going on. And we do this in April and in October. The Halloween parade, we try to engage with the kids and give them educational materials and things. Car seat safety program, that's kind of one of those things that a lot of people don't know, that we have 2 certified car seat technicians that install and inspect car seats to ensure child passenger safety. Back in our day of raising children, we just put them in there and made sure that something was latched and they survived. Now I'm not sure how they survived or how we survived without those, but there are a lot of things related to properly installing a car seat and making sure it's not expired, that it hasn't been in an accident, that the weight of the child, everything has to fit. They told me that even if a car seat comes with a cup holder, if that cup holder is not installed with the car seat, that's not technically installed correctly because it was manufactured with that on there. And, don't think about those things. But they have, last year, Barton County received the award for the largest number of installed and checked car seats. And I asked the girls yesterday, and they said so far they've installed or checked 50, at least 50. So that's phenomenal when you think about children being safe. We do provide these opportunities outside of our office space. We have set up in different communities and offered those checks for random people to come, bring their children, bring their car seats, and have them examined. We're currently working on one with Hoisington to schedule there in November. Vaccination initiatives, I couldn't talk about what we do without bringing that up. I think a lot of people think that's all we do at the health department is give shots. We stay very current on the ACIP and the CDC recommendations. And as you know, it's been a challenge since January, just pivoting constantly and keeping the trust and getting the correct information out for people to make decisions on what they would like to receive. We do a lot of consults and provide information for them to have discussions with their medical providers. childcare facility surveys and inspections. We have a childcare surveyor in our office, and anyone that does childcare or has questions about childcare, welcome to call her. She serves 6 counties. She provides orientation for anyone interested in starting childcare, provides resources, support. Right now, childcare licensing is going under the children's cabinet, so there's just kind of a on paper transition happening, but the work is still continuing pretty similar to what it's always been. She does provide safe sleep education and also investigates complaints as they arise. We came to you probably a couple months ago now on a transportation planning grant, and that was a grant to bring and address transportation gaps for people to get where they need to be. That grant is $239,138. And we have been anxiously awaiting getting started on it because the papers that we had received said that started October 1st. The delay in the government shutdown has created a few barriers for us, and we have just constantly reached out to get connected with the right people. And yesterday that happened. So I know we're a little late to the game at getting started, but they assured us that we can make changes in our timeline and all of that. So that was a big step yesterday to initiate that conversation. I've talked before about community health needs assessments, and those are required by hospitals every 2 years to conduct and public health every 3 years. We have been blessed in Barton County that we are invited to the table for those when hospitals have them, because I feel like it again is a collaborative effort to see what the gaps might be in the communities and how we can be a part of filling those gaps. The 3 initiatives that came out of the most recent from each Ellenwood, Hoisington, and Great Bend was transportation, access to healthy foods, and mental health. So those have been the 3 initiatives that we have been focusing on more so. Partnerships, I think can't stress enough to attend those meetings where there are partners there, to get together with resources, to know what each person has to offer and bring to the table. And we have the luxury of being in the size of community that we have, that we recognize a lot of people and we can call upon them. And if they don't know, usually they know someone who does. So I think getting those partnerships established before a crisis is very, very important. I need to bring up fiscal management and grant oversight because a lot of our services are based on grant funding. Grant funding has its requirements with it, and usually the grant funding is, in turn, we have to provide data, we have to provide objectives to support that grant funding. With that said, we have multiple standalone programs by KDHE that we have to enter data into so that they can extract that for public health issues. So with grants, we have, it's very well managed, I will say that, because we have 3 different budget periods to look at. We have the county budget period, we also have the state, and we have the federal. So all of those kind of overlap, and to try to keep all that straight, I feel blessed that our department has a financial officer, because it becomes very confusing for someone who doesn't know all the ins and outs of the financial and the fiscal. But also, along with that, we can't rely on a grant to sustain things. So there are a lot of contingency plans with those, that if the funding starts to go away, or now with the government shutdown, we're seeing that with WIC. We're kind of watching for updates as they come in, but WIC funding has been on hold for the food nutrition program. As of yesterday, I believe we think that there's enough funding. The state is telling us to get through November, part of November for the food part. As far as administrative, it may still end the end of October. But for us locally, the contingency plans that we have in place allow us to pull from other grants for salaries and things. And the way we've done that is cross-training staff. I sometimes am jealous of big health departments that have a TB nurse or an immunization nurse, and they can be totally versed on that topic. Us being the size we are, we kind of have to know a little bit about that and a little bit about that and be able to jump and pivot. And it's been to our advantage of that because I feel like we need to cross-train. For example, we have a clerical WIC person, but she also cross-trains in payroll, in vouchers, that kind of thing. So we can adjust wages based on that, pull from other sources. Our interpreters interpret for all of our programs, so we can pull from those grant funds for that position. So it just goes on and on of how we can do things, keep operational, even if that person had to be gone for a short time. You know, we still have people there that can do the work. I think mainly sharing ideas, bringing ideas to us of things we can explore to provide for the community is important. We're open to that. Last week, we had a advisory committee meeting that we meet once a month, 9 members, and we go over things just of what we've even talked about here. And they graciously invited the commissioners, also as the Board of Health, to come and have lunch with us and have a conversation. So that's huge. And I share that at different meetings whenever I can, because a lot of communities don't have that interest or that collaboration. So I feel that's very important to keep transparent, keep knowledge out there of what we're doing, that kind of thing. A lot of common language that we hear, collaborative, transdisciplinary. Last week, I believe, at this meeting, there were several times I heard collaboration, innovative, inspire, invest, economy. Those are all things that it all fits together. It all fits together. I just want to end with a bit of history because that's what I do. So public health is not new, as you know. This was a speaker we had at a regional meeting, and I shared that with you last week at our advisory meeting. This is Leading Health, How You and 30,000 Kansas Help Communities Thrive. And the speaker was Ed O'Malley. He's the CEO of Kansas Health Foundation. I ordered a bunch of books, so I will make sure that each of you have them and some other community partners. But a lot of good information in here, and it's nothing different than what I've talked about of coming together and making those things happen. But we have to invest. We have to invest in our health in our community. I will say that when he wrote this, he did see that he used the 2023 data. Kansas is ranked 29th in the nation, according to health rankings, with 1 being the best. In 1991, Kansas was 8th. So something's happened in those 34 years that hopefully we can use some of the ideas and initiatives in here to turn that back around. And then the history of me comes into play because I have 2 history public health books that were written for the state of Kansas. One was written in 1931, and I was real excited when I saw that because it was my dad's. But also the things in here: eat healthy, eat your vegetables, take a bath, wash your hands. You know, this was for school. This was for school. And I got excited thinking, gosh, that many years ago. And there's a book 2. Well, I also have the book 2, and book 2 was written 100 years ago. So in 1925. Evidently, book 2 had information before book 1 was ready to publish. But again, get 8 hours sleep at night, drink water, eat your vegetables, exercise, play outside. You know, it's nothing new. So good information. So with that said, any questions? I kind of ran through things. Really, the people who know the most about these programs are over there working. I'd love to have each and every one of them here, but can't do that. They're busy. So
Madam Chair. Karen, how many grants do you currently have?
we work with about 20 right
Wow.
now, and all of them have different budget periods.
Mhm.
And of course, the percentage that goes towards salary of each employee varies with every grant. And that's where it becomes shuffling.
It's a lot of grants to manage.
Madam Chair. Karen, so I know you work in the schools a lot, and what all do you go in and teach them and the different grades?
We have over the years multiple topics. Sometimes it's just been daily living skills. Sometimes it's just general health. Sometimes we've been invited to talk about sexuality. But it really depends on the school and what they want. But we are open to doing that at any time. We just have to have permission to do that,
So they have to invite you in.
right?
Okay, well, we'll include you. There's a Kiwanis program that we're gonna, and Marissa will be included in this, a whole bunch of partners. The sheriff, I'd like to see you come. And it's actually called Don't Meth With Us. And I got to see it at a conference and is really, really good.
Hmm.
And I wanted you guys to see it before and we'll invite the school too. I think it could really save lives, but we'll see what you guys think as well. And there's a group that does this and goes around the state, and then they'll teach us how to do it so we can do it each year and figure out what grades. They do it in the 5th grade, I believe. And then they've had ways to catch up with their high school and their junior high, depending on what all the partners think and see. I'm real interested to get your guys' opinion, but we want the professionals to come out and show how it's done. And so they'll be here in December. So I'll get a hold of
Okay.
you.
We have had requests for businesses that staff does a lot of home visits, and they just needed reassurance and educational information on bed bugs, scabies, those kind of things. So they call the health department to come out, and we do. I mean, we don't have a fix-all, but we can give some information and things to try to do, and so,
Okay.
Well, thank you.
thank you.
You.
Great program.
Okay, with that, we move to item B, Juvenile Services, Stepping Up Juvenile Justice in Kansas update with Minnesota Fancy Juvenile Services Director.
Good morning, Commissioners.
Morning.
I would echo the thanks for the opportunity to provide an update. As you recall, back in February, you gave permission for Barton County to be a pilot of the Stepping Up initiative. And just as a reminder, the Stepping Up initiative, I mean, this has been a framework in the making for the last 10 years. They've already done this in the adult system. And so it's only now that they're proceeding with the juvenile system. And so with the support of other local government partners, they really tasked us pretty simply with 4 questions that we've been navigating since that original meeting. And the first question was, do you have cross-system collaboration? And, it took a little bit of legwork on my part to get this going, but at this time we have over 20 partners that are invested to continuing this conversation and going through these 4 questions. And so I think that speaks volumes in and of itself. It includes local government. Thank you, Commissioner Zimmerman, for participating. We have local law enforcement. We have school partners, our area mental health, to include then also private therapists. We have the college. We have specialized services that have been valuable just with helping us have a better understanding of what is available. And that's important for us. Again, when you're talking about programs and systems, as Karen said, you don't know what you don't know. And if you don't know what those gaps are, then you can't be a part of the solution. And so I think that that's beneficial in this process. So when we submitted our question 1, as far as cross-system collaboration, it was a no-brainer. We had it. And so that was readily submitted. Question 2 was a little bit more in-depth, as you can see from the screen. And I have copies for you guys if you want to take with you, just so if you have questions after you leave here today. Question 2 took a little bit more of a deeper dive, and it was about current processes, what that looked like, and again, talking about the gaps, also talking about the strengths. And so before you is what's called a sequential intercept model. And one of the things that I will tell you that I think is an amazing strength for Barton County is something that has evolved from the original foundation with the adult system is we have an intercept 0. And what's important about intercept 0 is that's really talking about all of the prevention efforts that exist before a youth should ever have any kind of interaction or escalation into the juvenile justice system due to a behavioral health issue. And so you can see there in that first column, we have the schools, we have our SROs, we have our specialized services with Sunflower Early Ed and ABA, and you have juvenile services. We offer intake and assessment. They can be voluntary, they can be walk-in, and also family advocacy. And so just a really unique opportunity for this county to truly recognize the efforts that are being made, because I think sometimes we can get in the weeds and say, well, this isn't working, that's not working, who's doing it and whose responsibility. And I think that happens just because of frustration. But I think I would want to emphasize that we have an amazing amount of prevention that's afforded to all youth in this community. It's just a matter of being aware of it. So as you go through the additional intercepts, you can see up there, the next one would be where law enforcement would actually have an opportunity to cross paths with the youth and what that would look like for them. Law enforcement has multiple opportunities. They can arrest, they have the authority to do that, or they can offer a notice to appear, and you can follow the map if they do a notice to appear, what that would look like. If they arrest, then that means that our agency would be responding to whichever location to process them. By law, we have the opportunity to process and release back to the community with or without restrictions. And then the overarching piece is if they meet the criteria through the assessment instruments that we use at Juvenile Services, then to actually detain them. And so regardless if it's somebody with a behavioral health issue or any other youth, we take that very serious when we are considering detaining a youth, for the simple fact that I'm cognizant of that is through the sheriff's budget and the county. And so when we were talking about detaining any youth, I want to be a good steward of those dollars and making sure that the right population is being detained. And so I think, again, we have to take that step back of when we have somebody that is maybe in a behavioral health crisis, and part of this process will be, what is available? What are the options, and what would that look like going forward? So intercept 2 is looking at if they are detained, then what happens? The courts have 48 hours to make a decision if they're going to continue to hold that youth because they feel like for community safety or flight risk reasons that needs to happen. And I would say we, again, have great partnership and collaboration with our courts and our partners because we do have other alternatives to detention. And so that could look like electronic monitoring. That could look at like supervision. We have been given the green light. We're no longer a pilot site for REPATH, but we have a statewide contract that's another tool that we can use for supervision of youth. It's app-based, so it fits that mold of population that we're targeting. And so we have cooperation and buy-in. And so you can see as the intercepts go across the screen, it's like those opportunities. It seems like sometimes those opportunities kind of wane, but that's just because of the progression in the justice system. It's to be held accountable for your behavior. And so as you continue to move across that path, services are always offered, but you've kind of put yourself in a situation where it's no longer a preventative effort or measure or an intervention. And so really something more serious needs to happen. And so intercept 4 is obviously incarceration in the Kansas Correctional Complex. And so for us, youth in Kansas can actually remain in the correctional complex until they're age 23. So let's say if the crime doesn't meet the severity that they stay there till 23 and they can have an earlier release. That's where you have that piece of coming out on what's considered conditional release. But then if they do come out into conditional release and back in our communities, we want to make sure that we have mechanisms in place for their supervision, for their services. We know from just historical purposes, whether it's a youth or adult, after that longevity of stay in such a place, that it doesn't always bode well when they come back out. And so making sure that they have a firm foundation when they come back out is vital. And
Gotcha. So at the age of 23, are they under your program or are they under community corrections? at that point?
If their crime of adjudication was under the juvenile Kansas code, then it's under us.
Okay.
Yeah,
I know that.
yeah.
Thank you.
Yeah, it's a great question, but and that's sometimes confusing when we have those adults that are on our programs, you know. So, yeah, great question. So, any questions about the sequential intercept map before I move on? Yeah, thank you. And if nothing today and there's something that sparks you later, just please reach out. And so, question 3, which we will receive information on tomorrow during our technical assistance call, is going to be speaking of data. And so data is one of those things that, you know, when I was thinking, what am I going to do? Is it going to deep dive into data? That was never a thought. But, you know, now as I continue in my career, it's one of those things that, you know, making data informed decisions is always best as opposed to anecdotal. Because the data doesn't lie, you know, and so I think that this will be an interesting next question for us to embark upon. And I've already thought ahead and even had these conversations when I first talked with all the partners about coming to the table. You know, what data do you want to see? You know, what is specifically, like from the area mental health, like how many screens are they doing for persons in crisis that are meeting a acute hospitalization stay? How many times is law enforcement having an interaction with the youth in a behavioral health crisis? You know, how many are we processing, and then making that decision of, can we serve them in the community versus do they need to be detained for safety? And I can give you an example. We had a youth last week in one of our local counties that, you know, is of a behavioral health crisis, but due to the severity of it, we had to send him to detention. It was a community safety risk, and we will do that. Even though we know that maybe it's not always in the best interest. So, some of the things that have come up when you start talking about data is that everybody's favorite, HIPAA. And so we really have to start navigating what that's going to look like. Can we have these candid conversations with the memorandum of understanding? Can we have a greater conversation if we go the platform of a charter? One of the other pilots is Johnson County, and I've had the opportunity to have a couple conversations with Mike Brower and what that looked like for Johnson County to make the decision for a charter. It's really kind of interesting, and it's one of those things that I think that Barton County has the opportunity to gather more information on what that charter looks like. So what they did in Johnson County was they actually made it into a criminal justice advisory council. And so then that advisory council both served adult and juvenile populations and making, again, data-informed decisions. But they had the opportunity to also, you know, what do we want to look like? What do we want to look at in our county? And when they had that meeting, they looked at the disparities in criminal justice, supportive community mental health, crisis care, a data-driven justice solutions, and collaboration with other justice agencies. And so I think about that from just a futuristic vision as to the opportunities of, you know, always grants and always, you know, drug court or other programs that could come to Barton County that would serve the best interest of all, not just myself being under the juvenile agency. And so I think that there's just a greater opportunity for more conversation as to what that could look like. So there's actually going to be an in-person peer meeting November 13th, and all of those pilots will come together again and have the opportunity to say what's working, what's not working, how is the conversation going in your county, and what needs to change, and, you know, what are other takeaways? And so I'm excited to be able to see Mike again and have that conversation, you know, just as far as what did it take to get to that charter level? What does it take to have that greater buy-in? And, obviously questions bigger than me, but I always try to keep thinking 2 steps ahead just to see what that could look like. So the last question that we will adhere to before we turn over our 9 months worth of work up to the legislators is looking at the adaptation of policies over time and what that looks like for our community. And I think that regardless of which system we're in, having that conversation of what's working and what's not is always beneficial because, I don't always believe in doing the same thing because that's the way we've always done it. I mean, I sometimes think that we need to step outside that box and we can do things in a different way. I just need to maybe have a better understanding or vice versa of, well, what are you talking about? I mean, I can say that candidly, because even as we talk about fiscal things, my degree is not in accounting, but by golly, I sure do have to wear that hat sometimes. And then I have to be like, Matt, am I speaking apples to apples? Sometimes it's a win, sometimes it's not. And that's okay. He's there to help me. So I think that there's some great opportunity to come from this. And so I'm just curious as, again, thinking ahead as to what the legislators are going to do with this, because this is an initiative of KDADS, the legislators, the Department for Children and Families, KDOC, all of those partners. So that's where I'm at. We just submitted Q2, Q3 is on the way, obviously thinking ahead to Q4, but I appreciate the opportunity to update. And if there's any questions that I could help with, I'd be happy to do my best.
Madam Chair, I'm just impressed with the number of partners that you've been able to bring to the table for this discussion. So I know Barton County participated in a pilot with the adult program some years back, and so I'm excited to see the outcome of this.
Yeah, and they're still going. I don't know as if they're still meeting, and that's why I think about that greater charter and if that is what needs to happen. I know there's partnerships, I know there's still work being done, but again, having that opportunity to challenge and always be like, well, what goals do we want to look at for next year? I mean, what goals, what does it want to tackle as it relates to criminal justice, juvenile justice, or adult justice? I think that there's always that opportunity.
Appreciate your work on this.
Thank you, Commissioner.
Thank you for the update.
You bet.
Thanks, Marissa.
Okay, moving on to item C, executive session. Seeing no reason for that, skip over to ending business. Following the close of the agenda meeting, the commission will consider authorization of personnel changes for classified positions, sign any documentation approved during the agenda meeting, or sign any other documentation required throughout or county business. Similar action may take place throughout the day. Appointments, although subject to change, the following appointments have been scheduled: 9:30 or close of the meeting. We have planning session with media consultants, 9:45 financial and program update with Matt Potzner, 10 a.m. request for proposals with Derek, IT director. At 10:15, we have a program update with Wendy, county appraiser. At 11, Freedom's claims update with human resources team. And after lunch, Travel 389 is taking us at 1 to the Marmy Auto Group. We will go to Marmy Ford, then Marmy Dodge, Chrysler, and then Chevrolet. 2:15 or somewhere thereabouts, we'll be at Custom Floor Design. At 3 p.m., we will be at Corinthians Hill Event Center. County edition of KVGB AM, Thursdays at 11:05. Members of the 20th Judicial District Juvenile Services Department are scheduled for October 23rd, 2025. That gets us to other business under discussion items. Do any of the commissioners have any discussion items?
Madam Chair, I do. There is an opportunity for everyone on Friday and Saturday to go to the biggest, best garage sale you've ever been to at the event center. And it's for the Golden Belt Humane Society. So it's for a good cause. Friday, it'll be from 2 to 8 p.m. And Saturday, it'll be 8 to 2. And if you have some donations, not clothes or shoes, though, they don't want those, or books. But other good items that you have around the house that you want to get rid of, you can drop them off on the south side of the event center from now until the event.
Good. Okay. Anything? Ellenwood won their regional volleyball last night and moved to 40-0. 40-0.
Wow.
So this is a historic season for Ellenwood High School volleyball. So they played sub-state on Saturday, and I do not know the time, but it will be Saturday in Ellenwood. So if they win that game, they'll go to state. So
Go garage sale and then go to volleyball.
Raj still then come watch volleyball.
Heck, yeah.
So very exciting season for the girls. So very proud of them all.
Well, and Madam Chair, we have to give a shout out to the Great Bend Panthers. Friday night, another amazing game.
Yeah,
Yep,
I did listen to that. on
Incredible game.
radio. What
very
a show.
cool.
And the Hoisington Cardinals.
And the Hoisington Cardinals. Yes.
Mhm.
I don't know who would win if the Hoisington Cardinals played the Panthers.
I don't know if did we change something in the water in Barton County?
I know, right?
Years ago or something?
Panther volleyball team won the WAC championship, right? Which was the
They
first
did.
time in quite a while.
Wow.
So,
Great.
yeah,
Shout out to all those athletes and students.
Absolutely.
great job. Okay, then we have citizens or organizations may present requests or proposals for initial consideration. Commissioners are available to the public on Tuesdays during regular business hours. One or more commissioners may be present in the commission chambers conducting county business throughout the day on Tuesdays. Commissioners may individually schedule personal appointments related to county business at their discretion. And the next regular meeting will be at 9 a.m. Tuesday, October 28th, 2025. That's the motion to adjourn.
So moved.
We have a second.
I'll second it.
I know who we're giving that one to. We'll let Bev decide. So all those in favor say aye.
Aye.
Aye. We are adjourned.